Hello all, good evening, a very good evening to one and all. Myself, Dr. Soumya Shri. I'm an Ayurveda doctor by profession, and I've been working as an associate professor and consultant in the department of Kaya Chikitsa. Kaya Chikitsa in general, it comes under the general medicine. So I'm working in that particular department. So for people who are new to Swasthya, let me introduce you to Swasthya. It is an initiative which is all about ensuring awareness and authentic knowledge of Ayurveda as far as well-being is concerned. Right. So this is the second webinar of the series. In the first webinar, we had spoken about the introduction to Ayurveda as to what is Ayurveda and where did it origin from, what are the common misconceptions which we have about Ayurveda, and the reasons why we have to choose Ayurveda and things like that. If you have missed the webinar, kindly download the Ayurdynamic app, and the recording is provided in the app. Even the future webinar recordings would be available in the app as well. So thank you for joining us today. So stepping up the ladder to the second webinar, let us talk about how to understand health here. All right. Rather, I would put it as by knowing the definitions of health, you can be rest assured that you're doing well on day-to-day basis. Also, these are the things which needs to be observed and also kept at the back of your mind to have a guarantee that you're apparently healthy, there's nothing wrong with your health, you're absolutely doing fine. So going forward, what does WHO tell about health? Let's see what WHO would tell about the definition of health. Okay, the World Health Organization, which is known as the supreme body for the health related issues for all over the world, it defines health as health is a state of complete physical, mental, and social well being, and not merely the absence of disease or infirmity. Uh, in this definition, we need to observe that. Um, they have not just given importance to the absence of diseases or the absence of the weakness or the feebleness. Infirmity is nothing but the feebleness. So they have also given importance to the wellness. All right. So to call a person healthy, they also stress on the fact that the body must be in a condition of well-being. So the key word here would be well-being, which is recently introduced in the the contemporary sciences. uh, Further, what type of well-being are they talking about here? Is the physical or the bodily health, the physical well-being, that is physiologically, you are sure that your body is running good. The mental or the psychological well-being, where your emotions, you're mentally doing great, you're psychologically doing great without any psychiatric uh, abnormalities or things like that. And also, surprisingly, I would say that they have also spoken about the social well-beings. So social well-beings is you is about you're in a good job, you're earning well, you have your basic necessities of life. So all these comes under social well-beings. All right. So to assess one by one, what might come under physical well-being uh, would be the normal body physiology, the good body mass index, the good blood parameters. All these comes under physical. The normal blood works, what you do regularly, the normal checkups what you do regularly, all that come in physical parameters of well-being. The mental parameters, how do you assess it? As I told you, it is related to the psychological well-being of the individual. So to make sure you're functioning at the optimal level without any sort of stress, anxiety, depression, or any other symptoms. Mentally, you're happy, you're doing well. So that comes under the mental well-being. And social well-being, as I told you. But this is a very interesting thing which is added in the WHO definition of health to know whether you are healthy or not in general. It's a comprehensive definition. So that is added to the definition. It includes things like, as I told you, the basic human needs, the peaceful community existences, the stable ecosystems where you're living. So all these come under the social well-being. So this is a comprehensive idea about what is meant by good health according to the World Health Organization. So now, turning towards Ayurveda, what Ayurveda has an idea, what Ayurveda gives an idea about health, how it defines good health is, the first parameter is, uh, it is the flawless functioning of the doshas and the dhatus, what we call. So to understand this parameter, first of all, we'll have to understand these terms of doshas and dhatus, because many wouldn't be aware of these terms. So doshas are basically the basic functional base of any body. All right. So these doshas are actually three in number, and they are called as, you might have heard of these terms called vata, pitta, and kapha. So all of them have their assigned functions in the body. And on the other hand, you can divide the functions as to the digestion, metabolism, all these aspects, the hormones, the enzymes, all these are taken care by the pitta, the neurological aspects, the movement aspects, the circulations, all this is controlled by the vata, and the structural basis is maintained by the kapha. So all these, the tissue health, all this is by kapha. So there are certain assigned functions for all the three of them, that is vata, pitta, and kapha. And if those three are functioning optimally in coordination with each other, then that's a great sign of health. All right. And on the other hand, the normal functioning of the dhatus. So to understand dhatus, to put it in an approximate, easier term to understand them, they can be grossly correlated to the tissues of the body. All right. So they are, seven in number according to Ayurveda texts, and they are something like the rasa, which is correlated to the plasma, the rakta, which is the blood, the mamsa, which is the muscles, the medas, which is the fat content of the body, the asthis, which are like bones and related structures, like the ligaments, cartilages, and all that, and the majja, that's the bone marrow kind of tissues, and the shukra, that is the reproductive entities, everything that is related with the reproductive system. So basically these are the seven: rasa, rakta, mamsa, meda, asti, majja, and shukra. These are the seven dhatus, or the bodily basic tissues of the body. And the optimum functioning of the dosha and dhatu are very essential for the for calling a person healthy, and to assess yourself that everything, all the functions of your body are going on very normally. So this is one of the parameters, and basically everything, all the structures and all the functions, everything is covered among the doshas and uh, dhatus. All right. So the second criteria in the health index would be the normal or the optimum functioning of the Agni. We call this entity as the Agni, which is very basic for the understanding of Ayurveda. Because essentially we also quote that the any disturbance in the Agni can cause any sort of diseases, whether it is psychiatric diseases, body related somatic diseases. So any disease can happen because of the disturbance with the Agni. So what is this Agni now? How do you understand yourself with relation to Agni? So it is a comprehensive term which represents both the gut level digestion, absorptions, etc. All the digestive procedures, the assimilation, the digestion, the breakup of the food, the absorption of the nutrients, etc., all comes under Agni. And not only this, it it is also attributed to the metabolic functions, that is at the systemic level. All the, as I told you, the enzymes and the hormone related, the functioning related, metabolism related, whether it's anabolism, whether it's catabolism. So any metabolism related thing is correlated to the Agni. So, like say, for example, I'll just give you a example for this, that if you have developed slow thyroid gland function, for instance, which is called as a hypothyroid condition, you might have noticed the slowed metabolism. Like you're putting on more weight, or you are, having mood swings, or you have less appetite, and you have menstrual or the period abnormalities. So all this slowed metabolism symptoms can suggest to you, if you have observed such things in the body, it can suggest to you that you might be developing some thyroid related abnormality. This is just an example. So that is how you're supposed to assess yourself with relation to metabolism. Likewise, the hampered digestion in the gut level, if you could observe that, it could lead to conditions like the toxin buildup in the gut, which we call as ama in Ayurveda. So, in this can also lead to various abnormalities. Recent studies have shown that the gut toxins are primarily related to various conditions, right from the autoimmune diseases to the Alzheimer's disease, which is very prevalent these days. So this is possible by observing your digestive tract. And how do you observe your digestive tract, whether your agni in the gut is functioning well or not? It could be with your appetite changes. If your appetite is normal, like how it used to be, there's no changes with the appetite, you're good to go. If you notice any, appetite changes, or you have less appetite, you don't feel hungry these days, you need to assess that as to why you have this change. For example, you have maybe bowel movements. You have changed bowel habits, like you had normal bowels, but suddenly you developed constipation, or you developed the different frequency of your bowel movements. This can be an indicator of some impending things. So bodily metabolism becomes very important to understand if you're healthy or you are about to fall into ill health. So this is one of the important parameters. Observing this becomes very important. We'll speak about all this one by one in the coming webinars. And the third criteria would be the normal excretion of the excretory products, which are called as mala in Ayurveda. Malas are basically the ones which are the byproducts of metabolism, we would say. And these excretory functions should be optimum in your body. All right. So the third criteria with which you can assess your health is the excretory functions. Uh, they are basically three in number, and they are mentioned in Ayurveda as being the sweat, the stools, and the urine. These are the three main, excretory products which are developed in the body. And apart from the other malas, of course, the discharges, all this comes under malas too. But the three important malas could be the sweat, the stools, and the urine. Right? So the normal excretory process could be hampered if there is any impending ill health coming your way. So, like for example, as I told you, change in the bowel habits, or which is sudden, and too much or too little sweating, which is not normal to you. And the urine, like say for example, any changes with the frequency, color, odor of the urine, or if it is associated, if the urination is associated with other symptoms like the edema, the swelling in the body, or the abdominal pain, etc. So this could suggest about your health condition. So it becomes important to observe these on day-to-day basis as to what is happening with your excretory products too. It's a good sign, indicator of health. So the next health indicator could be something interesting and out of the box actually, which is told as prasanna, jnana, Dhyanendriya, Karmendriya, Atma, and Manas. Okay, so what are these concepts? Many of us could be hearing this for the first time, but Dhyanendriyas are, I'll just give you a gross correlation about what are Dhyanendriyas. Dhyanendriyas are the sense organs, basically, which helps you in understand or the perceiving the knowledge. All right, so the five sense organs are the ears, eyes, nose, tongue, and the skin, which are used for perception. All right. So, and these are the five means or the pathways through which we get the knowledge or stimulus from the outside. So these are the five sense organs and the five organs of action. Okay, like the hands, legs, the reproductive entities, and all these. So this these are the karmendriyas, which are again five in number. So the optimum here, the word happy doesn't essentially mean that it is happy, but it can also suggest that it is the optimum functioning of all these entities. All right, and again, surprisingly, they have also added the uh, optimum condition of the mind and soul here, which is a very rare thing to see in any other textbook and any other definition of good health. But yeah, and this itself makes the idea of health very comprehensive in Ayurveda. Uh, how do you assess all these becomes very important. We'll go with it one by one in the coming webinars. And now, having explained the understanding of good health according to Ayurveda, um, we have to be, next time we have to be cautious about your health. Try assessing yourself with regard to the above parameters. Even the recent textbooks of social and preventive medicines also have brought other dimensions of understanding health. But like say, for example, the physical dimension, the psychological dimension, the social dimension, and the spiritual dimensions, which we can get in the social and preventive medicine textbooks, which are and there are different definitions of health based on different dimensions. So that also becomes comprehensive these days. So having discussed about the understanding your health, let's next talk about what are the factors influencing your health. Either it can be the positive impact or the negative impact. So first among them could be your genes, genetics, and the body constitution. Of course, the body constitution is the prakriti, what we call in Ayurveda, comes by birth, and it is nothing different than the genes as well. Okay, so the health, ill health, lifespan running in the family, all could be the contribution of your genes. Like there are various diseases running in the family, like the obesity, diabetes, hypertension, autoimmune diseases. All these could be influenced from the family. All right. So the next parameter could be the age. Okay, so there are various age related susceptibilities, like say for example it could be respiratory disorders in childhood, like according to Ayurveda it is explained as kapha problems in childhood. In middle age or the adulthood, it could be more of pitta related problems like the acid peptic disease, the irritable bowel diseases like colitis and stuff. That could be more. So on the other hand, in old age, it could be more of vata related problems like the dementia, constipations, osteoarthritis, etc. Many of them. So there is age related susceptibility also. So according to what is your age, you can always be aware that this is what I'm susceptible to and this is what I need to take care of. All right. So the next parameter which we have to assess is the gender. All right. So I wouldn't say gender here. It is the sex. The sex is determined biologically, whereas gender males are susceptible to. There are few things which are females are susceptible to. Like say for example, depression and anxiety kind of things are more runs in the females because of the constant hormonal changes. Either it's in puberty or pregnancy, post-pregnancy or perimenopause, etc. Whereas alcohol, again, alcohol can be one best example where females are more susceptible for liver diseases when consumed alcohol than men. All right. So even the same quantity of alcohol consumed by a male and the female, if you compare, females are more susceptible for liver disorders and kidney disorders. So again, females are better at immune responses and fighting infections. And there are various examples where females are more susceptible in some conditions and males are susceptible in some conditions. The next is the lifestyle, that is your sleep, your food, your exercise, your addictions, etc., which can influence your health either in a good way or bad way depending on Have you exercise yourself every day? All right, so the next important factor is the psychological factor, like the stress, the constant state of angers, frustrations, which can lead to diseases, and which can lead to many psychiatric as well as psychosomatic diseases. So in fact, most of the diseases are psychosomatic. One best example I could give you is of IBS, which is the bowel movement related disorders, which is triggered by the psychological factor. You have changed bowel habits because of the stress. So that is one example. Of course, there are many more. So psychology, your mental status also can contribute. The next factor is the environment related factors. Of course, there are many. You can guess that is the pollution, the seasonal changes, the microorganisms from outside, the radiations, etc. Of course, even the occupational hazards, what we call, could be one of the environmental factors as well. So the next is the socioeconomic factors, that is the lack of health education. You're not enough educated about health. You don't have awareness about health. So you could be doing mistakes in your daily life, in your lifestyle. So and the other things like the poverty, like where people can't afford good food and lifestyle and the nourishing food, etc. So that could also influence your health. The last thing which could influence your health is the accidental causes, like the fall, the road traffic accidents, the external causes, any traumas or injuries, or that is something which influences your health. So these in general are the few things which can influence your health status, which could be a positive impact or a negative impact as well. So it's important to realize which of them are modifiable and which of them are non-modifiable. All right. So some things which are under our control and some things are not. Like say, for example, the genetic influence on health, the age, the gender, all these could not be under our control, right? So you cannot change your genetic makeup right now. You cannot change your age. You cannot change your gender. You cannot change certain environmental factors, like like the climate change with the global warming, which is affecting people very badly these days with regard to health. So this is these are something which are non-modifiable, which are not under your control. But there are many other things which are modifiable too, and we need to concentrate on them, right? So some of them could be the lifestyle, which we'll talk about in the coming webinars, as to how your daily regimen should be, how your night regimen should be, how your seasonal regimen should be, what you have to follow in certain seasons, and how your sleep has to be, your food has to be, your all these are modifiable. You have a certain good lifestyle changes which are brought about very slowly and steadily. You can definitely ensure good health. So we're going to talk about that in the webinars. So the other things like the socioeconomic status, of course, like the getting good awareness about health, psychological factors, like say, for example, the stress, which could be also, you know, um, addressed by doing meditations, by doing certain things which can bring down your stress levels, your anger levels, your frustration, or the negative emotions, which could be brought under control. And of course, the certain environmental factors. Why I mentioned environmental factors here is because certain things, like say, for example, a person is exposed to air conditioning every day from morning till evening because of the work, develops rhinitis. Definitely you are going to change your environment for good. Some people cannot take the weather of a certain place where they have shifted to. So certain environmental factors are definitely under our control. So so some things which could be changed have to be noted, and that positive change should be brought about. So finally, why knowing about health is vital is because health is an invariable part of our life, and it is the need for purpose of survival. All right. So we need to take the consideration of physical, mental, spiritual, emotional, social, and environmental wellness, which can influence the quality of life. All right. So the quality of life becomes depend on the lifestyle what we are leading, our health awareness. So So why knowing about health is important is because how much ever years we live, the quality of life matters. We have to ensure that we are living a life which is disease free and which is of well-being. So even the World Health Organization, for that matter, tells that health is the basic fundamental human right according to the WHO Constitution preamble. And yeah, so and we have to do everything in our hands to ensure that there is a healthy generation which is coming up. Of course, if we take care of ourselves, we are going to have a good generation ahead. So any questions, we would be glad to answer your questions in the follow-up session. It will be happening tomorrow at the same time. And kindly download the Ayurdynamic app, and there is a discussion forum there. You could uh, post your questions there, and we'll be happy to answer those questions in the next session tomorrow, happening at the same time. So please feel free to ask any questions which comes in your mind, anything related to your health, anything, any queries you have about Ayurveda in general about health. Please start a healthy discussion, and let's build a healthy community. Thank you so much for joining us on this session, and may Lord Dhanvantri bless all with good health. Thank you so much. Thank you so much for joining.